I am David Brigati, a hip and knee replacement surgeon with Texas Healthcare's Fort Worth Bone and Joint Clinic. We are doing a patient testimonial with Terrance, who is about 6 months out from Birmingham Hip Resurfacing. Hip resurfacing is an alternative to traditional hip replacement with excellent 25-year long-term outcome data for active men under age 65 with osteoarthritis. It has the advantages of minimal bone stock removal, improved return to impact sporting activities, less dislocation, less implant loosening, and better revision options in the future, if needed, than traditional hip replacement.
I first heard about hip resurfacing in March of 2020 after coming across a Andy Murray documentary, which he's a tennis player and he had his done. I chose hip resurfacing because I wanted the full range of motion back in my leg. I wanted to do the things that I used to love to do as far as playing basketball, jogging, and things of that nature. Actually, to me, it felt like it saved my life. I was mad all the time, didn't want to go anywhere. I was actually depressed. I can probably say I've been like that for 3 years. Now I'm ready to go, but COVID is here.
Any activities that you were hoping to do resume after surgery that you have not been able to achieve yet?
I've achieved every activity I wanted to achieve since surgery. Been playing basketball, work out every day. I get up at 4 o'clock in the morning to go to the gym and jogging.
Do you feel better than you did before the surgery?
Totally. My experience with Dr. Brigati was excellent. I would like to thank Dr. Brigati, first of all. He's actually changed my life. He gave me a new lease on life. He's very compassionate. He loves what he does, and he also reaches out not just after you have surgery, but while you're going through the process of healing. He not only contact me through email, even call. He would also call my wife and encourage her to give me encouraging words to keep going. Um, I only have great things to say about this man.
How long were you in the hospital?
I was in the hospital for only 1 day.
Did you have to do any formal physical therapy after the surgery?
Yes, I'm actually still doing physical therapy. I have my insurance company sent me a tablet with a Health Hinge app in it, which specifically for my hip, and I'm doing exercises every day as we speak.
Did you find it hard to stick to the entire 6 weeks of using crutches or a walker?
With the help of my wife and kids, no, I did not.
What was the hardest part of your recovery?
The hardest part, I would say, would be laying on my right side because I normally sleep on my right side, and that was the side that I had my surgery on.
How long until you were off the pain medications?
I actually stopped taking the pain medicine within 2 weeks after having the surgery.
How long until you could walk comfortably?
Comfortably, it took about 2.5 months before I can walk comfortably.
How long until you could sleep comfortably?
I would say probably 3 months before I can actually sleep on that side and not have any pain at all.
How long until you could drive again?
I was actually driving within a week of having surgery.
If you had to do this all over again, would you still choose to do a hip resurfacing?
Yes, totally, definitely.